Let's talk about something that affects millions of women, but often gets whispered about in corners: hormone replacement therapy, or HRT. If you're approaching menopause or already there, this information could be a game changer for you. First, let's break down what HRT actually is. Think of it like restocking a pantry that's running low. During menopause, your body's natural production of estrogen and progesterone takes a nosedive. HRT steps in to replenish these hormones, helping to manage those frustrating symptoms like hot flashes, night sweats, and mood swings that can make life feel like an emotional roller coaster. Now, here's where things get interesting. The latest research has completely transformed how we view HRT. Remember those scary headlines from the early 2000s? Well, science has come a long way. Recent studies show that when started within 10 years of menopause or before age 60, HRT can actually offer some impressive benefits. We're talking about stronger bones, better heart health, and even potential protection against Alzheimer's disease. Pretty amazing, right? But here's the thing. HRT isn't a one-size-fits-all solution. Think of it like choosing a pair of shoes. What works perfectly for your friend might leave you with blisters. The risks and benefits vary depending on your age, medical history, and when you start treatment. For instance, women with a history of certain cancers, blood clots, or liver disease might need to explore other options. Let me share some practical tips if you're considering HRT. First, timing is crucial. Starting earlier rather than later typically means better results. Second, there are different forms to choose from: patches, pills, gels, even vaginal rings. It's like choosing your preferred method of caffeine delivery. Some people swear by coffee, others by tea. Here's something many doctors don't mention. Starting at the lowest effective dose and gradually increasing it can help minimize side effects. And don't forget to regularly review your treatment with your healthcare provider. Your needs might change over time. One of the most exciting developments in recent years is the availability of body-identical hormones, which are chemically identical to what your body naturally produces. This means potentially fewer side effects and better results for many women. But remember this key point: your menopause journey is unique to you. What works for your sister, best friend, or that lady at yoga class might not be right for you. The key is to be informed and proactive in your healthcare decisions. If you're experiencing menopause symptoms that are affecting your quality of life, don't suffer in silence. Schedule an appointment with a healthcare provider who specializes in menopause care. They can help you weigh the pros and cons of HRT based on your personal situation. And hey, why not share this information with other women in your life? Knowledge is power, and someone you know might be struggling with these same questions right now. We're all in this together, and it's time to bring these conversations out of the shadows and into the light.